helps pay for itself, and it's a win-win for our state's economy as well as the working poor. You know, the decision to accept or reject $11 billion in new revenue that South Carolinians are helping to generate that would boost our economy while ensuring that hundreds of thousands of South Carolinians, that decision should not be made lightly or without thorough deliberation. South Carolina's hospitals stand ready to engage in this discussion and work with our governor and the General Assembly to make the decision that best serves the interests of South Carolina's economy as well as our families. Thank you.
Now join me in welcoming Ms. Teresa Arnold from AARP of South Carolina.
Howdy, everybody. I'm Teresa Arnold with AARP in South Carolina. We're a membership organization. We have about 550,000 members in South Carolina. We represent people 50 and older. And in South Carolina, there are 65,000 people 50 up to 64 years of age who do not qualify for Medicare and who do not have health insurance coverage right now. That's 65,000 people. These are people who have worked all their lives, they have paid taxes, and they deserve to have the benefit of health care insurance. Hard-working people in this state, and I know many, and I'm sure you do too, I have relatives who would qualify for this expansion. This is an opportunity for our state to do the right thing and to provide health care coverage that would help people not only with their health insurance, with their preventive care. Think about a 50-something-year-old man who lost his job in the downturn. It's much more difficult to find a job when you're 50 or older than when you're younger. That person does not have health care. He has a history of colon cancer in his family. He can't pay for a colonoscopy. But under Medicaid expansion, he would be able to access that care. Those are the people we're talking about in South Carolina. And AARP stands with Accept Me, South Carolina. That's Accept the Medicaid Expansion, South Carolina, coalition to urge our Governor, Nikki Haley, and our legislators to accept this ability to cover people in South Carolina. Otherwise, we will have a coverage gap for the lowest income working people in this state. People above 138% of poverty, people making more than $15,000 a year, will have access to tax subsidies, but those below will have access to nothing, zero. So I just stand here and am very proud that we are able to pull together all these people, and also want to urge you to contact your legislator and ask them to please make the right decision in 2013. Thank you.
Now from the South Carolina Primary Health Care Association, Ms. Latham Woodard.
Good morning. Good morning. As you heard, I'm Latham Woodard. I'm the CEO of the South Carolina Primary Health Care Association, which is the membership organization of the South Carolina Community Health Centers. And on behalf of those health centers, I am so proud that we joined this advocacy group to represent our constituents. The health centers in South Carolina saw over 326,000 medical patients in last year. 40% of those patients were uninsured. Now, if you add the underinsured, which we are working on how to determine that, because let's deal with this. You know, we talk about uninsured all the time, but there's also the underinsured. People who have $5,000 deductibles. Okay? People who have just catastrophic insurance, so listed as having insurance. But we need to look at all of that. And our health centers are proven economic engines. They are community businesses. You know, you don't have to look far to find someone who's uninsured or lacks appropriate health care. I'm sure everyone in this room right now know at least 3 to 5 people who have no insurance coverage. So there's one thing having insurance coverage, and then there's another having appropriate access to care. And we need both of those. Among our family, friends, neighbors, we feel for them because they don't have that. And although it's, it just kind of bothers me that people are very frightened about a change in healthcare system, but they should be more frightened about staying with the mediocrity that we currently have in our system. Regardless of how you feel from the politics standpoint, political arena, I'm going to say to our politicians, our legislators, policymakers, it's time to stop making healthcare about politics. It's time to start making healthcare about us. It's used as a political pawn in our political system. Keeping people covered and insured makes even more sense in tough economic times. People always talk about the economy. We need people healthy to have a healthy workforce. And people kind of forget that. We need people healthy to be educated. This is a cycle. They all work together. You can't do one without the other. Many uninsured people that we found in our system, they are employed, but they just can't afford insurance. They are family members who may be employed. And expanding public insurance gives more people more options in prevention and avoid illness and expensive treatment. Okay. I go back to the appropriateness of health care. I know change is scary. I know that. But when it comes to health care, and when it comes to the more than 760,000 South Carolinians who are uninsured, change can't come soon enough. So we may be scary about change, but let's think about our brothers who they need us to make these changes. The old system managed disease and was more costly. We have a sick care system. And the new system deals with more about prevention of disease, costs less, and excludes no one. This is a prescription for sound physical and fiscal health that we cannot ignore. So I commit to you, and I have some of my health center CEOs over here and health center staff who's going to back me up on this commitment that I'm making on behalf of the South Carolina Community Health Centers, that we stand ready and willing to work with our partners, legislators, and other political leaders to take advantage of this opportunity for our state to ensure access to quality health care for all South Carolinians. Thank you.
Now for the South Carolina Appalachian Social Justice Center, Susan Berkowitz.
Good morning. I'm Sue Berkowitz, and I'm with the South Carolina Appalachian Legal Justice Center, and I want to thank all of you for being here and thank all the wonderful partners who are here to now announce Accept ME South Carolina, Accept Medicaid Expansion South Carolina, from the nonprofit groups to the many members of the clergy who are here. We are so glad that we can all be here to work on this very important issue. Expanding Medicaid for the over 300,000 uninsured but newly eligible people here in our state. Those people who will otherwise be left behind. Access to health care is a critical issue for South Carolinians, but it's out of reach for so many who cannot afford to pay, despite working so hard every day. And now we have a serious and important way to ensure that those individuals will have access to health care through the expansion of the Medicaid program. If we are willing as a state to accept billions of dollars to implement this important expansion program offered by the federal government, it's time for us to all stop playing politics with health care. I personally look forward to the day when I can pick up my phone and someone's asking me, Ms. Berkowitz, I need health care. Where can I go? And I don't have to say to them anymore, I don't have anywhere to send you. I can say, you are eligible for the Medicaid program. Whether you're old or you're young, you live in rural South Carolina or urban South Carolina. The arcane rules for eligibility are gone, and if you are low income, working poor, you are eligible for health care and Medicaid. And I would like to issue a challenge to those policymakers who are having to make the decision as to whether or not we expand. I have heard statements that access to health insurance won't make a difference to anybody in South Carolina. Well, you know what? I have access to insurance and it makes a difference for me and my family. And for those policymakers who tell us it doesn't make a difference, I have a challenge for you today. Cancel your health insurance because it doesn't make a difference. So I urge all of us to come together to tell the governor, to tell our legislature that quality, affordable health care for all is no longer a dream. It's a must for the people of South Carolina. Thank you.
This morning and from those who are represented today, Medicaid expansion for South Carolina is a health care issue, it's a political issue, it's an economic issue, and it's not going away. As chair of the South Carolina HIV/AIDS Care Crisis Task Force, I am both proud and honored to be part of Accept Medicaid South Carolina. Access to good quality health care is a human right. It is not an entitlement for those who can afford it. Thank you for being here. As an announcement, I'm supposed to let folks know that if you have RSVP'd for the training, that meeting starts at 12 at the Clarion. And for those of you who aren't aware, there will be a community forum this evening at 6 o'clock at the University of South Carolina Law School Auditorium, and we welcome you there. Thanks again for being here.